Hi everybody, this is Abby with Scrap and Abby, and it has been a super long time since I have done a video. As most of you know, my last video on my YouTube channel was talking with you guys about my upcoming surgery that I had on March 2nd for trigeminal neuralgia. I had the micro vascular decompression, but they ended up having to do a neurolysis in there instead. So I'm going to kind of update you guys on that. And if I'm looking off, I'm sorry, it's because I have my camera viewfinder in the front of me. So I'm trying to make sure I'm staying in frame. And so a couple things have happened in the mix of having brain surgery on March 2nd. We actually moved to a new home when I was about, I'd say, close to a month post-op. Of course, I didn't do anything because I'm still on restrictions. So I'm sitting in my new craft room. It's not put together. This is a closet behind me. So, for those of you who are watching this, because of the title, it's going to be about, my post-op from my trigeminal neuralgia. I am a paper crafter and mixed media person. So my YouTube channel is crafty stuff, except for this, because I'm just trying to document this for my own purposes and also to hopefully help other people who have trigeminal neuralgia and are having to have the surgery, and just kind of my story with that. So that's kind of why you're seeing crafty stuff, and it's not put together. I'm still slowly working on it because like I said, I'm still under restriction. So I think the last video I posted, I actually was talking about right before I went into surgery. I did one in Portland. I live in Oregon, and I had the surgery at OHSU, which is Oregon Health Sciences University in Portland. And we spent the night up there the night before surgery because we live about close to 2 hours away. And I had to check in at 6 a.m. or 6:30, I think it was. And so just to kind of not be rushed, we spent the night in Portland. Our daughter, who is 15, went with us. My son, who's 19, he stayed home because we have a little Dachshund. She's actually under my table, so if you hear barking or anything, it's just her. Hopefully she's sleeping. And so he came up early the next morning with my mom and the rest of my family. So the three of us spent the night. My husband took me to dinner, just trying to kind of get me relaxed because I was obviously very nervous about having brain surgery the next morning. So I'm going to try to include some pictures at the end of the video. I did put pictures on my Facebook profile of me, like, a couple weeks out and a couple days post-op, that kind of thing, of my incision. My surgery was on the left. I thought today would be a good day to do the video because my hair's up, and that way you guys can see a little better. So I'm going to turn. I'll try to zoom in maybe. I hope I'm on frame. It's hard to tell because my hair's already grown in so much. My incision starts right here, and it goes all the way down to here. And you'll be able to see a little better when I show you guys some pictures at the end. And let's see. So my surgery started, I think, around 7:30 or so is when they took me in. I was in surgery for about 4 hours. And I was in ICU for one night. I didn't have to stay in ICU for 2 nights, luckily. And then I ended up staying in the hospital until Friday. So I was there for a total of 4 nights. Went in on Monday and came home on Friday. And if you see me doing this, I have to tell you guys ahead of time, the left half of my face is numb from surgery, including my mouth. And so sometimes when I talk, and I'm going to be totally real because I don't want to be dishonest in my experience from the surgery and my recovery, I kind of have a little bit of drool that kind of goes right here. I can feel it a little bit, which is weird because this is all numb, but that's why I keep doing that. So I apologize if that's distracting. I'm still getting used to my face being half numb, and it's something I knew was going to happen from surgery, obviously, but it's hearing about it and kind of preparing yourself that you think, and reading and researching about it, and then actually experiencing it is totally different. So that's kind of what I'm feeling right now. So, and I don't have my timer on this camera. I have a different camera right now. So I apologize if this goes too long. I'll try not to make it too rambly. Anyway, so I had the surgery, spent the night in ICU, and kind of had a hard time waking up from anesthesia a little bit. And they had to put oxygen on me because I was just having a little bit of difficulty breathing. It's nothing related to the surgery. It's just me. And but as soon as I woke up, I had absolutely zero trigeminal neuralgia pain. It was amazing. I could not believe that I had zero pain in my face of the shocking, stabbing pain that I was having. Even the ear pain was gone at the time. So what I was experiencing is obviously, a lot of pain from the incision. They put a cranial clamp in your head when you have this surgery because they want to make sure that your head is stable and still during the surgery itself, because they're working so close to the brain stem. You don't want to get bumped and then have a spinal cord injury or death. Obviously is the worst case scenario. So they told me before I went into surgery they were going to put the clamps up in here in the hairline, because they try not to put it on the face to prevent scarring. I have a scarring condition called keloids, and you can Google that if you want. It's Keloids. I've had those since I was 12. It's like kind of a scarring problem. And so they were trying to do that, but they ended up putting the screw, I don't know, you can't really see it, but I can feel it. It's like right here. So I had one here, and then I had one in the hairline here, and then one in the back. So I had a Band-Aid on my forehead because it was kind of a, a sore, because it's a screw. I don't know how long it was. I didn't see it or anything, but it obviously goes into your head. So I had a lot of head pain, headache right here for the first 3-4 days. It was totally like somebody had, like my head was in a vice grip, and essentially it kind of was from the cranial clamp. So I had a lot of that pain, and then lots of nausea, kind of the normal things that you experience after having surgery, and what you're kind of told that you'll experience after having this particular surgery. OHSU did a fantastic job of keeping my pain controlled and managed. Like I said, I was there for a total of 4 full days, and the staff up there just made me feel like I was like royalty or something. They were waiting on me hand and foot, constantly checking on me. Let me backtrack. I'm sorry if I'm forgetting things. I'm trying to go in order, because I'm actually 14 weeks post-op, and today is June 2nd. And my plan before surgery, as I documented, was to do like a couple weeks out, a month out, but that just didn't happen. And I'll explain why that happened in just a little bit. So, when the first night in ICU, for the first 24 hours actually after surgery, they wake you up every hour on the hour, and they come in and they do like this a series of neurological tests. They make you smile. You have to, stick your tongue out, and you have to squint and, frown and that kind of stuff, and raise your eyes like this real big, because they want to make sure that you're not having any issues with your facial movements, since they were, because they cut the head obviously, and they're cutting, cranial and facial nerves, and then they want to make sure that you're still having functionality, even though your face is numb. If you have the neurolysis, which is what I had, then, they want to make sure you can still have facial movements. So they do that, and they check your vitals, of course. And then I think I was about 3 days post-surgery, maybe it was the second day post-surgery, and they sent in some physical therapists, because they wanted to get you up and walking around and make sure you're moving okay. They came in and to help me, get up and walk. And by this point, I was walking myself. My husband was helping me. I was still hooked up to IVs. But, getting up and going to the shower, which felt great. And then, obviously going to the bathroom on my own, that kind of thing. But they wanted to kind of get me up and ambulating a little bit more, like down the hallway just a little bit. They put these compression things on your legs too. I forgot to mention that at the beginning. And they go off. I think mine was going off like every 5 minutes, 10 minutes, I think when I timed it. And it's just this, it's just like a wrap that goes around your leg, and it compresses, and it just goes like that. And it's automated. And that's just to prevent any blood clots, because you are laying down so long in bed in the hospital. So they would take those off, obviously, when I would get up to use the restroom and things like that. So the physical therapist came in to walk with me, and I was not having a good day, pain-wise and nausea-wise. It was, I'm not going to go into detail with that, because everybody knows what that is like, nausea and getting sick. And so I was not feeling well, and so they said, well, come back the next day, and I felt much better. They took them a couple different medications for them to kind of regulate my nausea. They ended up giving me Phenergan. And if you don't know what that is, you can Google that too. But it is also, I used to be a nurse in an OBGYN clinic, and that was something that we would prescribe to patients when they were pregnant to help with morning sickness. And it's also used to treat nausea in general use as well. And so that's what works best for me. And so as soon as I got that in the IV, it was like night and day. And I got up and walked down the hall a little bit, felt pretty good. You go pretty slow because you're kind of woozy from having the surgery and everything, and that was my experience. And I was able to go a little bit farther each time. And my husband put me in a wheelchair, because one of the nurses told us that outside it's just beautiful. I'll try to put some pictures of the view from my room too. It was just an amazing view I had out my room. It was just awesome. the whole experience, besides having, brain surgery, was great for me. And so we went outside, and we had a view of Mount Rainier, which is in Washington, and Mount Hood. And so it was just nice to kind of get out and get a little bit of a breeze. Of course, they didn't put, I forgot to say this again, I'm so sorry, you guys. I'm trying to remember everything from 14 weeks ago. My neurosurgeon, they don't bandage your head after surgery. They actually just put it was like a mesh, almost like a headband, because I obviously have a lot of hair. So they put like this mesh headband around, just to kind of keep my hair up out of the way. And then a couple days, they had like a kind of like a foam thing pressed against the incision initially, but they took it off. It kind of fell off after a couple days. It was just kind of stuck in there with the headband. So when I was able to take that off to get showered, you put a washcloth against it, and you kind of were washing your hair. And my husband was helping me with that piece, because like I said, I've got a lot of hair, as you can tell. So anyway, I went outside, and you're on the, the neurological floor. So there's like all kinds of patients, and they're recovering from different surgeries and stuff. And I got a few stares from some little kids and stuff, because, I was out in the general area, and, my hair was up like this at that point, and, and they could see this really long incision right here and stuff. But, anyway, so it wasn't awkward or anything, because obviously I was in the hospital, but I didn't want to, you kind of want to be a little private about it, because to me, it was a little embarrassing, because I didn't want people to ask me like, oh, what'd you just have done? And I'm not feeling very good, and my face is half numb, and I can't really talk right, and feels like you have a stroke or something, until you kind of get used to how your face feels numb, at least for me, my experience. And let's see, so that, and then I started walking more and more every day, getting up more. I was able to eat a little bit more solid food. For the first couple of days, I was really just eating a little bit of Jell-O and drinking lots of Sprite and water and things like that. You definitely want to be hydrated, because it helps decrease the headaches. You still have them, but it helps decrease that. And it's just good to have a lot of fluids after surgery anyway. They had a bed in the room for my husband, so obviously he stayed with me. He couldn't in ICU that night. He ended up staying at a hotel, again, up in Portland, the same hotel, which was great. And I'll try to remember to put the link in the video, or mention it when I edit, in case there's anybody else in Oregon who's going to be seen at OHSU with Dr. Burchell, who was my neurosurgeon. Sorry, I didn't say his name at the beginning of the video, because they do offer a discount if you stay, if you're going to be a patient. So that's great, to help with that cost. And so he spent the night there again the second night, and then they also gave him a discount because I was still in the hospital. And after I was out of ICU the next day, so Tuesday night through Thursday night, he was able to stay in the room with me, which was great. Because you just want your spouse close to you, or whoever it is that goes with you, a parent or a friend or whatever, just to kind of have that support system. And he brought up my Whoopee, which is what I call my blankets. I'm a purple fanatic, in case you guys can't tell from a lot of my projects, and my nails are purple, and I got a lot of purple in my room and everything, and my necklace is purple. Anyway, so he brought up my Whoopee. Again, that's what I call it's like a lap blanket, kind of like a throw. And I didn't know he was bringing that up, and he had it in the bag, and he brought it into the room when he came to stay with me. And it was nice to have kind of a piece of home, to make you feel kind of like you were at home. And it was a comfort to me, because again, mine is on my left side. So I found myself, I have a squeaky chair, sorry. I found myself sleeping a lot in the hospital bed, kind of upright like this, and I would put my blanket up here like this, and it was just a nice comfort thing for me. So that might be something, if anybody who's going into the hospital to have the surgery, that you might want to consider, maybe bringing something like that, or a pillow or something that is a comfort to you, because, even though I'm 42, I feel like a little girl, because I had to have my blanket with me. So that was nice. The ride home was not bad at all. They made sure I had enough IV medication on board before they took the IV out the day I went home, because again, we had to travel almost 2 hours home on the freeway. And I got home and got upstairs, and then I was basically in bed until my post-op appointment, which was 2 weeks out. And I got up just to shower and use the restroom, and it was back to bed. They don't say you have to be on bed rest or anything like that, but we have a 2-story home, and I do now again. And so, I wasn't doing a lot of stuff. My husband, I'm really, really, really blessed. I have an amazing husband who's very nurturing, very patient. And my daughter, my son at this time had moved out. He's going to college, so he had moved out at this by the time I was a couple weeks post-op. And my daughter was obviously still lives at home because she's 15. So between my husband and my daughter, I was very well taken care of. I didn't have to worry about anything. Every need was attended to, which is amazing. And I would encourage anybody to get whatever kind of support you can, especially the first couple weeks, because you need somebody there to help wake you up, to take your pain meds. For the first week, I was still taking pain medication oral, like every 3 to 4 hours, depending on my pain level. So, it's nice to have somebody there to help wake you up with that, kind of get a pain schedule written down, or pain medication schedule written down, and also to kind of have somebody help keep track of how the incision is looking, helping to get in the shower, out of the shower. You don't want to trip and fall because you're on so much medication and you're still kind of woozy from having, brain surgery. So that's kind of my 2 cents on that. Let's see. So I was feeling pretty good, as far as having brain surgery, no pain in my face, the numbness. Let me talk about that real quick. So because they did a neurolysis, meaning they combed or frayed the nerve, so behind the back of the head here, they didn't see an actual true compression. So I didn't need the, they didn't, the schedule was on the paper, on the books, technically MVD/neurolysis, because they never know 100% for sure until they get in to see if there's a true compression or if they just need to fray the nerve or do both. So for my case, they ended up just doing just the neurolysis portion because there was nothing to, decompress in my head or in the back of the head there. So they combed and frayed the nerve, and when they do that, that obviously will damage the nerve, which will cause some loss of sensation. So the feeling I have, I kid you not, it's like a line just straight down my face, just like this, and down to about here. Now I am not so numb right here, but inside my mouth I am. It's like the left half of my tongue, the roof of my mouth, obviously the inside of my cheek, and even down my throat a little bit. It feels like I just left the dentist's office and had some Novocaine, but it hasn't worn off. And that's what I'm going to have for life. And that is the trade-off of getting the trigeminal neuralgia pain gone. And I would do it again in a heartbeat because that pain was so bad. And anybody who suffers from this, you guys know it is just horrendous, horrible, life-altering pain. And I would do it again in a second. So on that note, I am still trying to get adjusted to the numbness because it is so difficult to get used to this tingling sensation in your lips and the numbness in your mouth and the fact that you can't really taste on the left side. Now, for some people, they may not have it this extreme, and some people might have even more extreme numbness. It kind of depends on the level of them destroying the nerve, of course. So every case is going to be different. Again, this is just my personal experience with this. So it's just a little bit awkward and kind of weird to get used to that sensation because, and it's kind of hard to talk sometimes. I can tell when my pain medication is kind of wearing off and I need to take some more because it feels like the left half of my face gets frozen, and it feels like it's all loose like this, and then as I'm talking more, it gets tighter and tighter and tighter, and sometimes I have trouble articulating because I like stutter kind of because my lips kind of freeze and I go like that. I can't get the words out. So I just have to make sure I'm keeping on my pain medication still. And I'm 14 weeks post-op, and they told me it'll take 6 months to a year. They kept drilling that into my head, 6 months to a year before you're going to start really feeling more normal, so to speak. So I know I have a way to go still, and I'm trying to be patient, and I'm trying to learn to adapt to that. So that's kind of where I'm at as far as the numbness. I do have some pain around the incision still area, even though it's completely healed and it healed perfectly, no infection or anything. I do have a little bit of cranial fluid, and this might gross out, and I'm sorry if it does, but I had a slight CSF leak, and that's a cerebral spinal fluid leak, in case anybody doesn't know. I had a little bit of drainage coming out my nose, my face was swelling up, and then I had nothing out of my ear as far as drainage. But it feels kind of squishy when I push back here, and it kind of crunches. And when I asked them about it, they said it's a little bit of cranial fluid, but that in time will kind of seep back into my head. So I have a little bit of pain and kind of just, some headachy type pain from that. I can't lay on that side. Excuse me, I'm so sorry. I can't lay on the back of my head yet on the left side. It's still too tender, so I still sleep like I have since the whole neuralgia started on my right, kind of like this. It doesn't hurt really if I touch it. It's kind of a weird feeling sensation if I touch it. It's like I feel it, but I don't. And then in my ear, I forgot to say this too, the first few weeks, I kept hearing this whoosh, whoosh kind of a sound. And sometimes I get a ringing in my ear, and they told me that also will go away as just part of the surgery because they're working so close to the different, inner workings of the ear. I don't know the medical terminology for that, but the inner workings of the ear, they're working so close to that those, they weren't damaged, but they were affected a little bit. So it just takes a little bit of time for that to, and it is getting better for me. I don't hear the whooshing anymore. It was kind of like when you hold up a seashell and you hear the ocean. That's kind of what I was hearing. Now I just kind of have a ring in my ear off and on, but you kind of get used to it, which is crazy, but you just do. So I was about five weeks out. I plan on going back to work 6 weeks post-op. They like to keep you off anywhere from 6 to 8 weeks, depending on what your job is. Again, this is with my neurosurgeon's office, and depend on what your job is, obviously. And I plan on going back, but I started feeling new pain in my face, and it was different than the trigeminal neuralgia pain, and it was different than the post-op pain. And I was trying my best to explain to my husband what I was feeling. So I ended up, contacting OHSU, and they said, look, we need to see you in the clinic to kind of evaluate what's going on. So unfortunately, on May 7th, when I was seen, I was diagnosed with, anesthesia dolorosa. I'll put a link in the description below to a good website that explains what that is. But basically, it's another super rare nerve disorder that you can get as a direct result from having the surgery I had to fix the trigeminal neuralgia pain. So it's kind of like you're in this vicious cycle. So I get rid of the trigeminal neuralgia pain, deal with the numbness in my face that I'll have for life, growing back my hair, having an incision back here. And now I have a new facial pain. And so that is why I haven't done an update video as soon as I thought I had, because I was trying to mentally deal with physically dealing with having another nerve pain. So they can't treat this with surgery. There is no magic fix or treatment. And so what they did is they put me back on the gabapentin, which is what I was on before I had surgery, and did absolutely nothing to help with my TN pain. But they're hopeful that because this is a different type of nerve pain. See, like my ear is ringing so loud right now as I'm talking. It's almost distracting because it really amplifies, sometimes worse than others. And probably because I'm talking a lot. This is the most I've talked in one session. I hope I'm not going too long. I have no idea how long this video is. I'm so sorry if it's too super long. But you can't encapsulate all this into like a 15-minute video. It's just too much information for what I'm trying to share. So anyway, so I was diagnosed with that, and then they put me back on the gabapentin. I'm on phase 2 of getting to phase 3, which is going to be the max dose they're going to put me on. So they're not going to put me at, I was on 2,700 milligrams a day before I had surgery, and I was such a medicated zombie. I had a hard time remembering, focusing, difficulty, with attention to detail, and even driving a little bit, and that was scary to me. And so they told me to stop because obviously it wasn't working, and then I was going to have surgery anyway. So they're not putting me at that high of a dose again this time, but I am going to be kind of at a mid to high range dose. My husband just came home, so if you hear talking or something, it's him. I apologize. He didn't know I was going to do a video, so if I might have to stop this and maybe have a part 2, I might actually do that because this might be too long. So I'll go as long as I can. And my face is really starting to hurt because I'm talking so much. So I'm sorry, you guys. I'm kind of completely all over the place. But if you guys have TN or have had the surgery, hopefully you can relate to what I'm trying to say. So anyway, then I'm in the medication. Then I'm also being referred to a pain clinic, which is closer to my home, to try to help me manage and deal with the pain. And I'm looking for like some type of a chronic pain support group as well, because it's just, you feel like you just need to have somebody else to talk to. And I'm actually going to go ahead and stop this and do part 2 because I do need to go take some medicine because it's getting past my time I normally do. So you guys might see me in a completely different outfit. I might have to do part 2 tomorrow because my face is hurting pretty bad. I'm sorry. I tried to make this not like professional, but I wanted to make it where it wasn't so choppy and I'm scattery, and I feel like I've done nothing but that. So I'm sorry, you guys. So I'm going to go ahead and stop for now. Go take my medicine, check in with my husband, see what's going on for dinner. And then I will come back with part 2, maybe later today or maybe tomorrow. So I will see you guys next time for part 2 of my